Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist and headache doctor. Today I'm talking about, is allodynia related to medication overuse headache? Allodynia means that touch hurts. The definition of allodynia is pain due to a stimulus that does not normally provoke pain. An example would be a light feather touch that only produces sensation of touch but that causes pain. Allodynia is different from hyperalgesia, which is an exaggerated response from a normally painful stimulus. Although both can and often do coexist, most are types of neuropathic pain. Allodynia would be like sunburn, when my arm is sunburned and it hurts to touch it. Whereas normally it doesn't hurt to touch my arm. Inflammation around the blood vessels on the brain during a migraine attack is involved. The nerve endings around the blood vessels send signals along the nerves to the central nervous system. This can result in a throbbing head pain of a migraine. Acute pain treatment that works stops the signals coming in from the peripheral nerves, and when these signals are not stopped, spinal cord and brainstem nerves continue to send their own signals and maintain the pain of a migraine. Within as few as 1 to 2 hours of activity, they become free of what started them in the first place. They become sensitized or hyperexcitable, and this is called central sensitization. So normally touching the side of my head doesn't hurt. The stimulus is perceived as touch only. Pushing a sharp pin into the head or touching the head with a hot hair dryer would activate pain and temperature fibers in the scalp and feel hot and hurt. If it got too hot, it would hurt and be painful. Allodynia is found with stage 4 of a migraine timing cycle with chronic migraine due to medication overuse headache or just with a plain old migraine. It's due to central sensitization because the central nervous system, trigeminal nucleus, and cutaneous scalp fibers are inflamed. After a sunburn, touch of the involved skin area hurts. The touch fibers in the skin of the back and shoulders are inflamed by the burning of the sun. Wearing a shirt or a jacket over a sunburned shoulder or arm would be perceived as painful, not as just touch. Touch of one of the side of the head during a migraine may also hurt, as the pain sensory fibers are activated. Activities that may cause pain with allodynia are combing or brushing the hair, wearing a hat, using earrings, a necklace, glasses, or lying in bed on the involved side. All of these touch activities may hurt in a person who has allodynia related to migraine or medication overuse headache. Is allodynia related to medication overuse headache? Allodynia relates to medication overuse headache may occur in 3 to 4% of patients with migraine. In the first edition of the International Classification of Headache Disorder 1, published in 1980, this overtreatment syndrome was called rebound headache. And this was the usual clinical situation with a headache patient would be the patient with a migraine would complain of severe, usually early morning headache, and they would take their painkiller, butalbital or hydrocodone, and the pain headache would go away, only returning hours later worse than before. The headache rebounded, much like a rebound in basketball. Frequency of migraine can be referred to as episodic or chronic. According to International Classification of Headache Disorders, published in 2018, episodic migraine is 14 or less migraine days, headache days a month, and chronic migraine is defined as 15 or more headache days a month, 8 of which have migraine features. The term migraine features here means severe, one-sided throbbing, disabling, headache with nausea, vomiting, and sensitivity to light and sound. Chronic migraine is 3 to 4% of all headaches, and 80 to 90% of patients with chronic migraine have medication overuse headache. Therefore, chronic migraine and medication overuse headache are commonly associated together. Related questions. What is the migraine timing cycle? There are 4 steps in the migraine process, which I like to call the migraine timing cycle. The first step is trigeminal inflammation on the brainstem. Second step, at 20-40 minutes into the headache, is the ganglion of the nerve and the artery of the brain starts to release the inflammatory neuropeptides, neurokinin A, substance P, and CGRP. Third step occurs about 2 hours into the headache as the release of the chemicals causes meningeal artery vasodilatation. Then the fourth step, at 3 to 4 hours, the neurochemicals cause inflammation of the thalamus, which is the deep nucleus in the brain in the center of the brain, which is also called the pain center of the brain. The fourth step is also called central sensitizations because steps 1, 2, and 3 really are inside the skull, but they're not inside the brain. Only the thalamus, the deep nucleus, is part of the brain. So stage 4 of a migraine cycle is where allodynia occurs. And I have a picture of the migraine timing cycle on my webpage here and at other spots at drmigraine.com, and on this blog article and other articles. So why is migraine defined as lasting 4 to 72 hours? Migraine is defined by the International Classification of Headache as lasting 4 to 72 hours, and this is done not for some trivial abstract academic reason, using 3 or 72 days as the time migraine lasts, but rather because that's how long it takes for these inflammatory neuropeptides to come in the body and get out of the body. Research studies have been performed wherein a doctor would start a migraine in a research subject by injecting the vasodilator nitro. In an hour, an increased inflammatory neurochemicals was found by collecting blood from the jugular vein as it drains down the brain to the liver and then discharged into the toilet after 3 days. These inflammatory chemicals could be found in 3 days in this experiment. What causes the development of medication overuse headache? If one treats migraine with over-the-counter drugs like Advil or Tylenol, they don't stop the release of these neuropeptides and the inflammation, yet triptans will block the release of the inflammatory neuropeptides, and that's why they're so important for acute migraine therapy and effective drugs for treating migraine. But to be effective, triptans have to be used to start the headache cycle within 20-40 minutes of the start of the headache. Are there no drugs for treating migraines? Triptans are contraindicated for patients with coronary artery disease or uncontrolled hypertension and cannot be used in those patients. So some of these patients may respond to other drugs. The G-pens they're out can be used in that situation, timolol eye drops, and things like that. Also, 80% of patients respond to triptans, but 20% do not, and they may need butalbital or opiates, which really shouldn't be given. Cambia, Aleve, DHE, intramuscular injection, nasal spray, timolol eye drops should be used. And general migraine patients should be treated with triptans, but never with opiate drugs or drugs with butalbital, like Fioricet. Butalbital is a barbituric drug, in my opinion, is the worst drug in the world that causes medication overuse headache, and it has been banned in every country in the world except Canada and the United States because it causes medication overuse headache. The use of butalbital in America is a political issue to be resolved by legislatures, and so far neurologists and headache doctors have not been successful getting legislators to eliminate the use of it. What about treating migraine with over-the-counter drugs? Caffeine, Tylenol, Advil, Aleve, and triptans can cause medication overuse headache if too many drugs are taken over a period of time. ICD-10 states it may take 3 months of medication over treatment to cause chronic migraine, medication overuse headache, central sensitization, and allodynia. The general rule of migraine patients to prevent medication overuse headache is to limit over-the-counter drugs and painkillers and triptans to all drugs really for acute therapy to no more than 2 days a month. What happens if over-the-counters, butalbital, opiates, or triptans are used more than 2 days a week? Medication overuse headache is the current term for persons who have chronic migraine from overuse of medication. It used to be called rebound headache, an old term. If the patient uses over-the-counter medication or triptan, a transition occurs so that after several migraine headaches have occurred within a week or two, every time the patient takes caffeine or Tylenol or triptan, the inflammatory neurochemicals are released and they stay in the body for 3 more days, and so the migraine process becomes continuous. It's kind of like putting lighter fluid on a fire, which makes the fire continue to burn. Is there a more thorough discussion of the migraine timing cycle? Yeah, I have that on my webpage at drmigraine.com. However, this timing cycle points to the reason why migraine patients should be treated early with a triptan. The patient only has 20-40 minutes after the onset of the headache starting before the neurochemicals are released, and a triptan drug will block the release of these chemicals at that time. It's just that simple. Most patients don't know how to treat early, and therefore the chemicals are released to inflame the trigeminal nerve, the arteries, and the thalamus, and the patient returns and states, this drug doesn't work. It's reported that triptans will help migraine headaches anytime during a migraine, even if it's treated late, but unless the migraine is treated early with a triptan, you're not going to get a headache-free time within 2 hours. Headache-free means that all the migraine symptoms are gone: headache, nausea, sound sensitivity, light sensitivity, olfactory sensitivity, mental confusion. in my office, I go over and over again this point with patients, treat early, and then the next time they come in, they report they did well with the triptan. The migraine was gone early. Many patients tell me they'll get relief within 15 or 20 minutes, which is shorter than the time it's reported that the drug to work. Well, how is medication overuse headache treated? Treatment here is treatment of medication overuse headache is cessation of painkillers. You have to explain it to patients and tell them they'll feel better and need to get off the drugs. They got to stop NSAIDs, caffeine, triptans, barbiturates, oral opiates. This can be done all at once, so the drugs may be tapered off slowly. Patients should always do the migraine lifestyle. Probably start a daily preventive drug like one of the new CGRP drugs. Probably take 1 or 2 weeks prednisone or Medrol dose pack to decrease inflammation in the headache. And then use DHE, timolol, or olanzapine for acute migraine headache management until the frequency of the headache backs off. All right, that's my discussion on the subject of allodynia related to medication overuse headache. I hope this is helpful. Thank you very much for listening and watching. Please click on subscribe down there. God bless all you folks with migraine. Follow me on YouTube for other YouTube videos that I have on migraine. And I will see you all on the next talk.